Good evening, everybody, or good morning, depending on where you are when you're dialing in. Simon Ramshaw here. I'm Managing Director of Attenuation Lasers Limited, a UK-based company subsidiary of Attenuation Corporation. To the right, you will all remember and recognize Dr. Rob Silverman. Good evening, or good afternoon, Rob.
Good afternoon, Simon. It's a pleasure to be here.
It's a pleasure to have you. I'd just like to point out to everybody, those horns aren't actually part of my head. They're on a picture behind the wall. I'd just like to make that clear at the start. So without further ado, everybody pretty much knows Dr. Robbie. He works with us on a regular basis, both by way of webinars and also seminars as well. He's chiropractor, clinical nutritionist, national international speaker, author of Amazon #1 bestseller, Inside Out Health, and founder and CEO of Westchester Integrative Health Center. So, Rob, thank you very much again. We're always honored when we get you on these calls. We're doing our best throughout the whole lockdown series to try to provide as much education and knowledge what we can across the pond here in Europe. And there's nobody better place to give that to yourself. So over to you.
Thanks so much for that stirring introduction. I greatly appreciate it. It's always my pleasure. Preparing on a weekend for this is, and I say this in all sincerity, it's exciting. I love to share and talk about these topics, and I love to share with everybody across the pond, as Simon broadly used. I think that's outstanding. I just want to say that I've always implemented the laser. I've been in practice 21 years. I've used the laser for 12, and the laser has never come in more handy than now, in that we have to remember it's contactless. More than just contactless, it's extraordinarily effective. And even to add another layer to its effectiveness, there's been some situations where I've had to lend it, rent it to people. So there's a plethora of different methodologies in which you can apply the laser. But for us today, in the next 70 minutes or so, I really want to show you how to implement a non-thermal laser into your practice. Because when you do, you're going to find a tremendous increase in patient outcomes. And essentially, just like the title says, you're going to be able to, manage pain more effectively and accelerate healing. And accelerate healing from the inside out. This is science. I just had a conversation with somebody, and they didn't believe specific numbers, but they believed in the laser because it's based on science, photon energy. So let's dig in a little bit. For me, whenever I practice, whenever I look at a patient, any modality, any tool that I use, I'm a proponent at root cause resolution. So you've got to target the fire and not just look at the smoke. And what I mean by that is, just because someone points to the front of their deltoid and it's rotator cuff, there's 17 muscles that insert on the scapular. So there's so many different angles, there's so many different muscles, there's so many different things. And that rotator cuff, if you will, is part of a unit called the human body, and the body's all interconnected. So if you're just looking at the smoke and not looking at the fire, you're never going to get the clinical outcome. Laser enables you to target the fire and not just the smoke. And that's one of the new terms that I've been using, and it's one of the reasons that I really relish using this low-level laser therapy. Global newswire, I mean, let's be real, as we like to say where I come from. Cold laser market is expected to generate almost $700 million by 2030 globally. I mean, that is a large sum of money without question. And we're seeing lasers sell more and more. The implementation of lasers. So real quick, there's your lasers. You see on the right, you have your handhelds, you have your accelerate, your EVRL. I'm definitely, without question, going to show you demos. So please hold on. I will turn the camera on. I know where it is. I've got a laser in front of me. I'm going to bring in one of my staff members that are patient. If you have any questions or requests, either via a verbal question or something that you would like me to do hands-on that's viable musculoskeletally, especially, I've got the FX635 at my fingertips, if you will. In the next room, I will treat and show you guys some secret sauces, some special protocols if you'd like. When you look at the slide in front of you, you're going to see that we've got the Zerona and the FX635. Implementation. Now, these are my top 15 conditions. This does not mean it would be your top 15 conditions, and it does not mean we're just encapsulating ourselves to these 15 conditions. But let's take a look at them for people who are musculoskeletally oriented, alternative doctors, and tell me if any one of these or a multitude of these fit into your practice right now. If this is what your patients are coming in that you want to be able to treat and get some additional vantage points and increase clinical outcomes. Number one, the spine, the upper, the lower, and the mid spine. The spine is obviously a very dynamic organ. Well, that should be, maybe I actually made a typing error, not hand and brain. It should be head and brain. So obviously my handwriting was bad. Mei is my wife, so it's all my fault. Nevertheless, the brain, the head. TMJ, TMD, a lot of growth in that around too. People are grinding more, they're stressed, they're eating at home. Shoulder regions, good examples of that, get a lot of great outcomes with rotator cuff, labrum. Elbow, tennis and golfer's elbow. I just actually worked on a patient today that had a bilateral tennis elbow. Carpal tunnel, the wrist, etc. Nerve entrapments. For me, that's a specialty item because I don't think enough practitioners address nerve entrapments, and I find that the assessment and the treatment with the laser for nerve entrapment is really a differentiation in clinical outcomes that I like most about the laser. Disc pathologies, you know, the bulge, the herniation and the like. Just because someone has a herniation does not mean that it is synonymous with surgery. Sciatica, or as I like to call it, sciatica, going down your side. Hip issues, pain in the hip. For me, the hip is a multiplanar joint. It's something that I look at, I evaluate when anybody has a lower back pain. If somebody's hip doesn't move, I know their back is going to overcompensate with too much flexion and rotation, leading you down that deleterious path of disc herniations. Knee pain, of course. Knee is a very interesting joint in that it doesn't really take much to injure it. Sprained ankles, feet. The sprained ankle is the most common sports injury. Plantar fasciitis. If you've had it, you never want it. Plantar fasciitis, 10 million Americans out of 330 have plantar fasciitis on any given day. It is without question tremendous pain at the bottom of your heel. Gut issues. I'm all about the gut to brain axis. Simon knows about that. I could talk hours on that. My new book coming out speaking about the bidirectionality of gut to the brain. However, with all that being said, lasers will help having a positive effect on healing the gut, healing the brain, and increasing the communication between the gut and the brain axis. And my specialty item, the vagus nerve, that's something that's taken the world by storm, talking about the vagus nerve, the tone of the vagus nerve. The vagus nerve has a very simpatico situation with the body. And if we can get proper vagus nerve tone, it really almost guarantees the best health outcome that you could want. I will give you a vagus nerve demo. I'll give you some advanced moves that I haven't shown before on any of the previous webinars. So the beneficial effects of low-level laser can include almost in all the organs of the bodies, in the tissues, the blood, the epithelium, the joint, the muscle, the bone, and of course, the neurons. This I took from Dr. Rob Sullivan, who I have a lot of respect for. He's the chief science officer with Simon out there, does a great job. So kudos to him for turning me on to the concept of preconditioning with low-level laser. I would have never thought about that. I brought that into my office in the last few months, working with a lot of my athletes, and the lasers can be used in a preconditioning mode. This way your muscles are protected. You know, we are, without question, at times where I am, too reactive and not enough proactive. Nerves will feel less pain. Low-level laser can prevent against specific organ problems. It can prevent pain. It increases healing after surgical procedures and can increase athletic performance. For you guys, soccer, I'm sorry we use the term soccer, your football players, pre-exercise of photobiomodulation are able to improve different functional aspects that will allow you to increase athletic performance. Biochemical markers related to muscle damage and inflammatory process to high-level athletes, and decreased exercise-related oxidative stress. You know, your athletes performing, they're not recovering, their performance will then decrease precipitously. So this may be for the mechanism of action through which laser promotes aerogenic effects and protective effects to skeletal muscle. It's very conceivable that the laser can be much more proactive than just using it in a reactive form once again. So many people ask me, I'd like to take a moment with this. Why? What's the big why? Why the laser? You know, again, 12 years of experience with it out of my 21 years of practice. It's quite effective. It's the speed of light. It's fast. Now, I happen to practice in New York. I'm 20 minutes outside of New York City. We have this expression, the New York minute. Everybody here is in a rush to go somewhere. So the quicker that we can make an impact, the more that that patient is impressed. You guys may be a little bit more analytical, and I appreciate that, but nevertheless, everybody likes a little boom at the beginning of a treatment. Lasers are research driven. They are FDA cleared. 18 out of the 21 FDA clearances in America, Erconia has, and they're empirically studied. Many of my colleagues have called me up and said, you know what, Rob, I've implemented the laser on this kind of condition, that kind of condition. People from overseas, where you are, from all the different continents, have said the same thing. So the idea of this empirical study, everybody who's put it in their practice and turned the power button on has gotten some really good results. It is without question practice building. We're in practice. We need to see patients. We need to heal patients. It is what pays our bills. It is our bloodline of what we do. Joint health. Well, initially, the laser was for all about joint health. Many of the FDA clearances were pointed at the different joints, but now it's really grown. It's bolstered into the idea of brain health. Brain health and the idea where I treat a lot of concussions, which will be very common in your athletic populations also. Maybe my favorite study, you know, I've used this a multitude of times, but I still haven't found one that does a better job. Please note on the citation, Clinical Interventions of Aging 2015, here you have 70 elderly patients with bilateral, obviously both legs, tri-compartment, 3 different compartments, knee osteoarthritis. One knee per patient received laser plus physical therapy. Another knee received physical therapy in the sham light. So essentially what happened was the left knee, which obviously needed total knee replacement, received physiotherapy and a sham light. The right knee received an appropriate laser, a real non-thermal laser, and physiotherapy. That sham light with physiotherapy decreased the need for joint replacement down to 15 out of 70 people. That is impressive. Whereas the real laser and the physical therapy took the laser group down from 1 in 70. It was 15 times more effective than an already effective physiotherapy. 69 out of 70 joints did not need to be replaced. Think of the healthcare costs. Think of you. Could you want to keep the knee that you have and be relatively pain-free and deal with what God gave you, or would you want the new knee replacement? Well, this speaks volumes, and I speak to this to a lot of people here. Joint replacement is very common. The laser is very effective in helping avoid this joint replacement. It's also very effective post-joint replacement. So here's some of the positive effects of the 635 red light. Number one thing, and sometimes we overlook the idea of getting the cell energy in ATP. ATP allowing for mitochondrial function. Mitochondria, obviously the powerhouse of every cell. So the idea of the flow of electrons and protons through the mitochondrial respiratory chain. Photobiomodulation stimulates cytochrome C oxidase, improves its catalytic activity, elevates ATP synthesis. All these results in the enhancement of neuronal respiration and metabolic capacity. So it's improving the mitochondria. The number one mitochondrial organ is your brain. You have an analgesic effect, decrease in pain, accelerated tissue regeneration, the stimulation of cell metabolism, helps with wound healing, great for lymphatic flow. So you're going to have an immune enhancing function, stimulation or microcirculation. And of course, you're going to have this pain relieving effect, which is a symptom. However, patients come in because it hurts, and you definitely want to decrease the pain as you heal the tissues, structures, nerves, etc. There is an attenuation of an inflammatory response and polarization of macrophages, the captain of the ship of inflammation, by photobiomodulation. Non-thermal laser, low-level laser therapy, photobiomodulation, in my book, they're all synonymous. So by evaluating anti-inflammatory effects of photobiomodulation, showed a suppression of the expression of a marker of classically activated macrophages. If your macrophages are up and they're increased, you have an infection. Inducible NO synthesis, well, nitric oxide is something that is a marker of inflammation. You would want to know that. mRNA expression. Is there anything being discussed more than mRNA now because of all these proverbial vaccines? The secretion of pro-inflammatory cytokines. Cytokines, if we could even say, have become very popular in the conversation because, again, of the cytokine storm. So cytokines are essentially inflammatory. When there's too many cytokines and they don't resolve, they're extremely ruinous to human tissue and human organs. TN alpha, another inflammatory marker. IL-1 beta, interleukins are inflammatory. And NF kappa B, the signal transducer of inflammation, which releases these cytokines and interleukins, would be a major source of concern for me if my goal in life is to manage and modulate inflammation. A lot going on here, without question, a flow chart with a lot going on. But the bottom line is, just want to talk about the idea of how it makes ATP synthesis and the end therapeutic effect of laser in that it has immune activation. It enables replication and repair of DNA, and it has an intensification of tissue rejuvenation. So the NRF2, this may be something new. Been doing a lot of studying in the NRF2, and this particular pathway is a critical pathway to me. So everybody take a second and let me dial it back a little bit. NRF2 for me is a key antioxidant pathway. It enables improvement in our detoxification, especially our phase 2 detoxification, and allows for cytoprotective effects. It's a critical element for appropriate mitochondrial function. It has neuroprotective mechanisms, and it allows to decrease neurodegenerative functions. The NRF2 pathway is not discussed enough because, as you see my citation there are no drugs that regulate or at least upregulate the NRF2, but there are a lot of natural ingredients that do. So let's talk about some of these natural ingredients. I'll give you a few. Sulforaphane, curcumin, alpha-lipoic acid, omega-3 fatty acids, good old organic coffee. I know a lot of you are tea drinkers, but good old organic coffee. And guess what? Non-thermal low-level laser increases the role of NRF2 in mitochondrial function. Here's two different citations that back this up. NRF2 has a critical role in maintaining cellular redox homeostasis. It affects the mitochondrial membrane potential and ATP synthesis. It influences mitochondrial fatty acid oxidation. It supports structure and function integrity of mitochondria. The activators have beneficial effects when mitochondrial function is compromised. Again, here are my citations on laser's effect on the NRF2. So this would be a critical element for a multitude of pathways, but maybe the biggest one is the mitochondrial pathway and the antioxidant pathway. 635 significantly decreased the rankle-facilitated NF-kappa B and intracellular ROS generation and increased the expression of NRF2. Another one. Low-level laser therapy may improve radiation protection through molecular mechanisms related to the NRF2 antioxidant pathway. I can tell you that this is one of the first times that I've shared this particular item with people. So this is one of the ones, if you could star it, it's without question a critical gem. It's something to imbue you with enthusiasm, to want to explain to the patients one of the main pathways that the laser helps with. So let's talk about the next big thing. And the next big thing for me is the EVRL. That's the Zirconia violet red laser. I was fortunate enough, honored enough, if you will, to do the FDA study on it in the musculoskeletal light, where we looked at both of these wavelengths, both a 635 and a 405 nanometer for chronic neck and shoulder pain. The patients had to have pain over 30 days. The average person actually had pain over 12 years. It was a one treatment challenge for 13 minutes, 1 minute per site, obviously 13 different sites. We used the visual analog scale. We used the pain scale to start. The VAS was filled out at the 3-minute mark, 24 and 48-hour mark. There was a predefined 30% decrease for a minimum of 65% of the patients. So let's analyze that via the results. And the results were as follows. 75% of the patients achieved a greater than 30% decrease in the VAS pain scale. The score remained high, please check this out if you will, at the 24 and 48-hour mark. The secondary efficacy, and this was quite a big takeaway, there was a positive change in range of motion and patient satisfaction improved. So when I say patient satisfaction improved, they were extraordinarily happy because they had so many conventional and non-conventional treatments prior to coming in. And to be honest, as a chiropractor, there is some predisposition or a thought that maybe we aren't good enough here. And that was washed away. I can tell you everybody who was new to my office became a patient. It was a patient boom. And I have to say that resonated. It resonated that it not only helped with the pain, it resonated that it increased the range of motion. The people wanted to seek me out as a practitioner, and I don't know if they would have if I hadn't used the device. The conclusion, overall, treatment with the red and violet laser outperformed the FDA red laser with respect to change in pain scores and increased shoulder range of motion. So the red and the violet together synergistically beat the red on its own. So the key theme, and what I really want that I hope everybody takes home with them today, is the idea of electromagnetic transfer. So energy is transferring from the laser into the body. Now the factoid is, so many people ask, well, how many photons are we getting? Well, here's the exact number: 8.2 billion photons per second per diode. I'll say that again, 8.2 billion photons per second per diode. So let's look at electromagnetic transfer of energy. Now, 800, I really should have used 810 in retrospect, was the baseline. 635 nanometers was 27% more energy than the 800 per second. The 405 was 5,700 more than the red. But when you looked at the baseline to the 405, it was 98% more. So what's the theory? What's the thesis? The lower the wavelength, the higher the energy. So the 405 violet light produces more energy than the red light at 800 and more than the 635. Do not throw the baby out with the bathwater. Do not get rid of your red light. Each one of these lights, 405 and 635 wavelengths, has distinct different properties when utilized together, enable you to achieve a synergistic outcome. The key to the red light isn't just that it's red. The key to the red light is the wavelength. So let's talk a little bit about the vagus nerve and how I apply it. And you know what? Before we go any further, let me share the red versus the violet. I'm going to tell Simon if you want. I know you've got a great handout. I'd love you to attach that. If you can't do it now, attach it later, where you really differentiate. You had shared it with me. I made it into a slide where you can show all the practitioners the difference between the red and the violet. Now, understand there's a difference between the red and the violet. When you put them together, you get all these properties. There weren't negative differences. There's positive difference. So you get them all together. But in a nutshell, the red is great for musculoskeletal healing. It's excellent for wound healing. It's great for action potential on nerves. Rockkind has done a lot of studies with that. The violet light is empowering. It's pathogen. It's antibacterial, antiviral, antifungal. Some of the more interesting things is that the red light works with the parasympathetic system. The violet light works with the sympathetic system. So when you put them together, you get a balance of our autonomic nervous system. And as a chiropractor, I find it fascinating to look at the autonomics, because we all look at the muscle and the nervous system, and sometimes we overlook the autonomics. Having said all that, one of the biggest things that I'd like to share is the idea of the vagus nerve. So for me, vagus nerve tone is huge. I have a patented move that we're going to go over. I have some advanced moves I'm going to show everybody today. The vagus nerve goes from the medulla oblongata down through the transverse colon, attaches to the outside of the transverse colon. It's actually able to communicate with what goes on inside your gut. It actually communicates with your microbiota. Your vagus nerve is the key element between the bidirectionality between the gut and the brain and the brain and the gut. Oh, just hold on one second. You can stay. It's cool. The brain and the gut and the gut and the brain. In that, it also is able to communicate with what's going on inside your gut because of something in your gut called a neuropod. That neuropod was actually isolated in July in Duke University Integrative Health Center. So now we know that it's actually sensing what's going on, that the idea of sensing, it's 80 to 90% afferent, where the vagus nerve is 10 to 20% efferent. It also, as you know, touches everything from the medulla oblongata down through the transverse colon. So it has the ability to help with your heart, it has the ability to help with your lung, it has the ability to help with your pancreas and the such. So the idea of getting a vagus nerve stimulation to allowing the tone to be a proper is a critical element, because when vagus nerve tone is decreased, you have an increase in peripheral inflammation. I'll say that again. When vagus nerve tone is decreased, you'll get an increase in peripheral nerve tone. Remember, your vagus nerve is in charge of your parasympathetic nervous system. It's in charge of your enteric nervous system. The enteric nervous system is the reason that your gut is called your second brain. That enteric nervous system has more nerve cells than any other system in your body. That's a critical element to getting to overall health. To be able to stimulate the vagus nerve and get a therapeutic intervention, you've shown to have promising results with vagus nerve stimulation treating chronic inflammatory disorders such as rheumatoid arthritis, diabetes sepsis, and lung injuries. We talk so much about the lung now, but we're seeing a tremendous new concept or a new pathway of the gut to lung. Vagus nerve stimulation, please make note, is tremendous in controlling pain in migraines and fibromyalgia. Vagus nerve stimulation has a positive, a robust effect on the gut. So they tested the effect of vagus nerve stimulation in endotoxin-induced intestinal tight junction injury with this horrible endotoxin lipopolysaccharide. And if anybody really wants a large conversation on LPS, please ask. We'll answer that in a Q&A section, which will be the last 15 minutes of this presentation. The conclusion was simply the stimulation of the right cervical vagus nerve ameliorated damage of the tight junction ultrastructure, and it did so by decreasing the upregulation of the spiking of the NF-kappa B pathway. So vagus nerve, great for the gut. Whatever you do to your gut, you do to your brain. Great for peripheral inflammation. The vagus nerve also has its tentacles into the central nervous system. So for me, everybody who does anything musculoskeletally, everybody who does anything along the gut-to-brain axis, anybody who wants to help somebody with some gut issues, the vagus nerve move is going to be a critical element. Here's something that'll piggyback on what I said before about vagus nerve stimulation actually decreasing blood-brain barrier disruption after concussion TBI. This particular stimulation attenuates cerebral vascular permeability and upregulates perivascular aquaporin 4 after TBI. Aquaporin 4 actually increases brain edema. Now, I specifically picked or at least chose the picture on the right because that's the stimulation that a medical doctor, with all due respect to our colleagues, would use to stimulate the vagus nerve. In my office, we use the Erconia EVRL for that. Now, here's some of our colleagues also that did a vagus nerve stimulation with low-level laser of 2 different frequencies. I typically use the violet light for the vagus nerve in the thoracic region, and then we'll switch to the red and violet. There's nothing wrong if you use the red and the violet together. I found it effective enough to use the violet in the thoracic and the red and the violet in what we'll call the auricular section. So the conclusion was very positive in that the use of red and violet lasers is useful in conditions where it's necessary to induce incremental increase of brain activity in many conditions. You're seeing the different conditions listed there. And of course, those conditions are also affected by when I affect the auricular portion of the vagus nerve. So now as a vagus nerve demo, I got it on? Great. So Simon, can you see me? I see that you're blowing up my phone. I can take a look. Do you mind coming in? So we got Stephanie. She's here. She's coming, actually. Siéntate. So we have one person from Spain. I'm going to do this. Hola, ¿cómo está? ¿Qué tal? Not bad?
It's good.
It's good. She's happy. So again, let me check. Can you? Okay, great. Can see its acne setting. So there's just too many. We have a couple of lights on. Let me see if I can turn the light off so you can see that. Perfect. So I'm on the acne setting. And I'm just going to use the violet light right now for the vagus nerve. So I'm going to turn it on. You'll see it on me. Medulla oblongata. She has the violet light on. Down through the, can you stand? Medulla oblongata. Down through the transverse colon. I'm going to do this. Perfect. Oh, you got it? Medulla oblongata. Down through the transverse colon. We do 3 to 5 sweeps of just the violet light per side. I'm not yelling in your ear, am I? 30 to 60 seconds. And remember, vagus nerve is bilateral. So when I say bilateral, obviously we're going to do the same thing. This is just for demo on her other side. So I just did her left and right side. If there's any questions about that, I'm going to check my phone right now. Let's see where we are. Okay, no questions. So I'm still on the violet light. Violet light, just to reiterate, please. Medulla oblongata down through the transverse colon, 3 to 5 sweeps, 30 to 60 seconds, bilateral. I'm then going to go switch back. I don't know if you can see it because of the lighting. I'm going to go and use the red and the violet light, and I'm going to do the red and the violet light right in the lower abdomen area. Did I just do something wrong?
If you click that, it's going to turn it off. I just don't know where the screen.
We just lost our screen for a second. I apologize. Ah, there we go. Thank you, Steph. I'm going to go right in the area of the migrating motor complex in the ileocecal valve, because that's a critical element. The vagus nerve has a direct correlation and an impact on those. Those will help with movement. So vagus nerve stimulation helps to avoid things that come with a slowing down of the ileocecal valve and the migrating motor complex, like SIBO, because most people are too sympathetic. Most people have a concussion. The digestion goes down, directly related to the change in tone in the vagus nerve. Now, she'll turn this way. You should be able to see that. I'm just going to make a little, I'm going to clear ours here so we can see clearer. We're still red and violet, which we talked about, and I'm going to go in the ear. I'm going to get the auricular portion of the vagus nerve. So I'm going to pull it away just so people can see. Go right in there. We're going to go bilateral. We're going to go both. Now, also, does anybody have any questions on that? I'll wait for. Anybody have any questions on the vagus nerve demo? We're good?
I think that's it, Rob. No, not yet.
Okay, because if they do, we can hit them again at the end. So there's a couple other things you can do. You can go into the jugular foramen right up in here, and you can take a little piece of what we call kinesio tape. I've actually showed Dr. Sullivan this one. Put it right by the jugular foramen, so it lays on their foramen, and what goes through the foramen in far as nerves is a few different nerves, and one of which is the vagus nerve. Okay. Now, what I'd like everybody to do if you get the opportunity, is if you have a request, we've got some time. I have some more slides to do, then we have some questions. If you've got a request, I'd be happy to do a couple of hands-on, and I would like to show the 635 at the end of this. I always like to make sure everything incorporates hands-on, but here it is in a nutshell. I'm going to shut a light off. It looks like the light is masking what you guys can see. So here it is. There we go. I finally got it right.
By the
Simon.
way, sorry to interrupt. Rosie's asking what settings on the EVRL. I know some will use a red and violet light. Do you just use the violet light? So you use the acne setting?
Yes, and I want to make this clear because we've had a lot of conversations about this. And I'm just going to turn the light back on so I can see everything. I happen to use the violet light in the area of the thoracic spine, as I said earlier. And I find that to be effective. And as you said, I will echo what you said. I happen to use the acne setting. However, there are practitioners who use both the violet and the red together. I don't have a problem with that. I just haven't found the need to do that. And I'll go through what I've done, and we'll go through the theory. It's not wrong. You can do that. You've noticed that I do use it in the areas of the migrating motor complex in the ileocecal valve down in the lower abdomen area, and I put it in the ear also. So I'm switching between the two. The way I got to the violet over just the red. So if you want to do them together, it's fine. But if you want to do violet or just do red, you have to just do violet. If you want to do them together, I'm going to give you a thumbs up. So I think, Simon, you can chime in. I think I've clarified that. There was always a little question that adding any red wasn't good, and that wasn't the case, and that's not what I said. I just want to make sure that we have it on tape, that they are synergistic together.
No problem.
That's good. I've used heart rate variability as my marker. So I found that the violet was needed to stimulate the vagus nerve. So the violet and red, big thumbs up. The setting on the red that I use, and you're going to get some different settings because everybody has a different setting. So we're talking about the frequency, which is the amount of time that the light hits the body per second. So it's 9, 16, 42, 53. I do switch and I'm not trying to confuse anybody, I switch my frequencies up all the time because I like to approach the body with a different stimuli all the time. So the body's constantly adapting and pulling in that photonic light. Do you have any other questions?
No, that's it. It's just more specific to the vagus nerve and settings so far. But if anybody wants to answer and ask any more questions, you'll see a questions button a little bit down the right-hand side. So feel free, and we'll either go through them mid, Rob, or we'll wait till the end.
Sure. Here's the other point I wanted to make about the EVRL that I didn't before. That violet light I have found to be extraordinarily positive when combined with the red, because the violet light deals with the fascia, the saran wrap of the body. So when you take apart the skin from a chicken wing, let's say, that white film in there, that's fascia. That's sort of what allows you to hold your body together. It's called like a tensegrity. And it's the white film on a salmon, and you go into the salmon, it's white, and what holds everybody together. That fascia is the finishing touch to allow for muscle tension. Fascial and fascial planes allow us to move. When we lose a percentage of our movable fascia in our lower back, we have lower back pain. So I do believe that the red light is excellent, but I think the reason that the violet with the red got a little bit better outcome was because of that extra fascial component. Now I'm going to pop off my camera. I'm going to lecture a little more. We'll answer questions, and I'll do some demos. So let's talk about some key laser therapy or key laser protocols for musculoskeletal injuries. Big takeaway, July of 2019, the FDA actually cleared the FX635 laser for whole body pain. Essentially, it had an FDA clearance for nociceptive musculoskeletal pain. So let's look at it for the idea on chronic lower back pain. You saw that was in my top 15. As we all know, I can give, and we all can quote a lot of numbers on lower back pain, but without question, it's the #1 reason why most people go into somebody's office. Or if it's not #1, it's #2, and fatigue would be #1. So let's look at the FX635. FDA clearance for the relief of chronic nociceptive musculoskeletal pain, as I said before. You're looking at a double-blind and placebo-studied. In that, they had 255 patients, 49% average pain reduction post-treatment protocols. No other therapies were administered during this laser treatment. When you compare and contrast it in the Journal of American Medical Association in a 2018 study in which they used 119 patients, opiates were used to the tune of 20%, and non-opiates, mainly NSAIDs, non-steroid anti-inflammatories, the improvement was 26%. Here's the key to this, or here's the disappointment to it. In those studies in JAMA, there were implementable adjunctive therapies. There were chiropractic, there were acupuncture, there were physical therapy. The use of the opiates, the use of the non-opiates and NSAIDs decreased the outcome. That 49% when we looked at post-treatment protocols in that 255 patients was a 1-month period. Unfortunately, in JAMA, with the opiates and the non-opiates, it was a 12-month period. So there's a couple of takeaways here. Takeaway #1, when we're trying to de-educate you and say, let's avoid opiates and non-opiates if we can, it was obvious that the opiates and non-opiates being used and administered did not allow for healing because non-steroid anti-inflammatories decrease pain, but they impair healing. Opiates have a similar function. As a matter of fact, 2 chiropractic adjustments over 90 days decreased the use of opiates by 55%. Unfortunately, the opiates and the non-opiates damage a lot of the treatments that many of the listeners would administer in their office. So we want to avoid those opiates and non-opiates. Laser alone decreased it 49%. So let me ask you, take a second, close your eyes if you will. If it's approximately 50% with a laser, how much with the laser in your treatments and no opiates and non-opiates would that patient achieve in that period of time, which was 30 days? Clearly more than the 50%. So the takeaway here is that laser is not only effective on its own, it's also effective and quite synergistic with any kind of musculoskeletal treatment. So let's take a look at the placebo group and the test group in the mean lower back VAS ratings. And what you see here is that the treatment ended approximately after 4 weeks. You see a continual decrease post-procedure with the laser. So what I'm saying very clearly depicted in this graph is after the procedure was administered, people got better because the laser has a long-term healing process and it has a global effect, whereas the placebo almost came back to the starting point. Here you have a similar thing, and it's printed points or data points on changes in visual analog scale and lower back pain. Here's your changes in your Oswestry Disability Index scores. And now you're looking post, not just 1 month, 2 months, but 12 months. So the original study in this lower back study had pain duration for approximately 98 months. The pain scores continued to improve to 17.5% more from 12 months post without any additional treatments. So people were getting better. Most people after treatments or many different treatments come back. They have a re-exacerbation. They have a re-injury. Did not occur with the application of the laser. Here's a study that just came out. Coney America did it in 2021. The study looked at 2 randomized, double-blind, placebo-controlled trials evaluating the efficacy of the RED 635 low-level laser treatment for lower back pain. So let's look at this. Let's look at the conclusions, and then let's have this little conversation if you'd like. The conclusion was very simple. Based on the data of 120 subjects, the use of the 635 nanometer non-thermal laser, that 635 is your accelerate, it's the red light in your EVRL, and it is your FX635. It was an effective means of reducing episodic chronic lower back pain of a musculoskeletal origin. At the end of the study, most subjects treated with low-level laser, 80%, 8 out of 10 obviously, achieved a greater than a 30% decrease in the baseline of lower back pain visual analog scale scores. One of the reviewed studies documented changes also in the Oswestry Disability Index, which demonstrated a clinically meaningful improvement in the low-level laser therapy treated group. Lastly, although additional studies are warranted, non-invasive nature of laser therapy enables this technology to serve as a primary treatment of chronic lower back pain. So you're thinking about adding laser. How do you advertise? What do you do? Go right for that lower back pain. That's your number one thing. More patients in your area, my area, wherever it is, have lower back pain. This is a great starting point. Here's another study in November of 2020. And again, this data was compiled from 6 IRB, Internal Review Board approved trials. They were looking at the efficacy of the 635 nanometer laser. The assessment was for the reduction in pain arising from chronic conditions. The active treatment group was vastly different in the visual analog scale versus the sham group by 30%. The active group also had documented significant improvements in range of motion, disability, and foot function index. So the conclusion was simple. Based on safety and efficacy of this review, which evaluated 419 subjects in various anatomical areas, the 635 nanometer laser therapy, cleared by the FDA, is the first laser for the indication of adjunctive use in providing relief of nociceptive musculoskeletal pain. A couple other additional studies I find very interesting in that the laser or non-thermal low-level laser or low-level laser, whatever you want to call it, has the potential for reducing inflammation, regulates the macrophages and the microglials, and may be an effective candidate for treatment of spinal cord injury. Laser also has a positive effect on interleukin-6, decreasing IL-6. Interleukin-6 may be the sheriff of pain in all the interleukins. When patients come in and I draw blood labs, if IL-6 is up, I'm concerned. It is a predisposition marker for lower back pain. And let's take it one step further. When you take a look at low-level laser, how it can modulate inflammatory mediators secreted by human annulus fibrosus during intervertebral disc degeneration, the microenvironment in the annulus fibrosus, the outside of the disc, were suppressed by low-level laser because it suppressed interleukin-6 and interleukin-8. Now let's have a takeaway. 405 nanometer most positively affected the interleukin. So whatever the red did, the violet did a little more, and the red worked with interleukin-8. The results indicated that low-level laser is a potential method for use in an IVD, intervertebral disc treatment. Plantar fasciitis, number one reason of heel pain. Let me go through the whole idea of plantar fasciitis very quick. Plantar fasciitis, we know number one of heel pain. The study was simple. 2 treatments a day for 3 weeks, essentially 10 minutes. And the bottom line was there was a precipitous decrease in heel pain. One of the first FDA clearances that the FX635 had. What was most interesting was that if I were to show you the graph, you would see this cliff-like fall after the stop of the usage of the laser. And what I'm saying is the laser, once again, cascades and enables patients to reach new heights once the body's health has been put in motion. So for me, this is chiropractic, this is PT, this is medicine, in that every one of us with our vast toolboxes are looking to enable the body to heal itself. And laser really exemplifies that idea quite well. I do a lot of concussions where I am, and I found that the laser is a great choice for concussion. So I'm going to spend a few minutes on applying the laser to the head. And then when I'm done with that, again, I'm going to turn on the camera and I'm going to show you the 635 up close and personal. Essentially, great article. Please take a look. Journal of Neuroscience Research. in that neuroscience research, November 2017. Here's a picture takeaway. Essentially, applying the laser to the brain, you had an increase in angiogenesis, blood vessels grew back. You had a decrease in brain edema. You had an increase in lymphatic drainage in the brain, an increased blood flow of cerebral oxygenation, neuronal progenitor cell synaptogenesis, and the increase in BDNF, brain-derived neurotrophic factors. As of 2013, we now know that the world says that BDNF, the increase, leads you to the growth of nerves back in your brain. Prior to that, it was not an accepted theory. Also, the application of laser to the brain allows for anti-inflammation in the brain. So it creates a microenvironment of anti-inflammation, which leads you to anti-apoptosis, meaning anti-cell death, and a decrease in neuronal excitotoxicity. In an epigrammatic fashion, the photobiomodulation using the red light was within this article was conceived as an innovative treatment for a wide range of neurological and psychological conditions. It's shown to be anti-inflammatory, anti-apoptotic, antioxidant, as well as neurogenesis occurring. The conclusion was, and please make note, amyloid B production and plaque formation, obviously that would imply that it's positive for Alzheimer's in this study. Improved memory and cognitive effect. It works to what we talked about before in the cytochrome C oxidase. And their takeaway in this study in Aging Cell, October 2019, that it's a viable therapeutic strategy, has great potential value and increased cognitive ability in combating Alzheimer's disease. Here is a study that was published in the Internet Journal of Neurology 2019, 40 patients, 5-minute treatment to the base of the skull and temporal area 2 times for 4 weeks. And the conclusion was simple. The study suggested that low-level laser progressively rearranged neural networks related to complex systems in autism. So we're starting to build a case for that. 12-month follow-up study after completion of low-level laser. There was improvement in symptoms continued in patients in the test group. This study's conclusion reaffirmed that clinical improvement may be pathophysiologically explained because low-level laser therapy progressively rearranges anatomical function and effective connectivity, modifying those neural networks related to complex systems found in autism. A different study in 2018 spoke to the positive effects in autism spectrum disorder. Now for concussion, and I'm going to fly through these. So if people have some questions, please let me know, because I do want to get to a section on how to implement. I want to take a few minutes. Essentially, this is my office. This is my rehab room where I apply a lot of my concussion protocols. The takeaways were, as a posed question at a previous webinar, is transcranial laser therapy effective in acute phase recovery and concussion? Studies show that low-level laser is effective in the reduction of pain, swelling, and inflammation, improves the cerebral circulation, improves neural function, improves neurological performance post-TBI, stimulates the growth of new nerve tissue, was shown to modulate oxidative stress, and downregulated pro-inflammatory microglial cytokine expression. The 635 red light nanometer modulates the NF-kappa B signaling pathways. Laser was shown to mitigate cell death. It was researched strongly in stroke injury. Laser also improved cognitive defects and inhibited microglial activation. One of the biggest problems that we have in the central nervous system when there's damage to the brain is the overactivation of the microglials. When these microglials, which are macrophages in your central nervous system, overreact, they start to eat brain tissue. Low-level laser stimulates BDNF. We had said that before. I wanted to add this citation. Now I wanted to get to the practice management building. And at some point, if Simon wants to chime in and really add the idea of support on any of these things, that would be greatly appreciated. So when you implement a laser in your practice, where do you start? I mean, that's what everybody says. How do you get people to know who's your first patient? Well, the first thing you do, without question, is you start with your current patient base. There's gold in your files. All your patients are right there. So it's very simple. Put a flyer up in front of the office. Let people know we now have a low-level laser. Let people in the room know that you now have a low-level laser. Create that awareness, soft awareness, if you will. Use one of our cornea lasers. Use one of the other speakers. Simon's got a large number of videos, a marketing portal, things of that nature to promote the laser. I made one on my own. If you're comfortable with that, great. I'll show you how. I'll suggest how. We'll help script it for you. But get an in-office video. Emails, MailChimp, Constant Contact. Do an announcement. Every month, you should be minimally communicating with your patients what's new in healthcare, what's new in your office. Prescription pad. You know, it's so funny. I went to the medical doctor. I had to go upstairs for something, and he gave me a prescription. A lot of times I'll say in chiropractic, at least where I am, we forget to give a prescription. Make the laser part of your prescription. Make the laser part of your report of findings. Make the laser part of your treatment protocol. When you do that and you add that in as an everyday thing, your patient base will grow and clamor for the use of low-level laser. Add it to your website. So now we're getting into a little bit of the idea of social media. Add it to your website. People search out. I get people every day calling about laser. They see me on my website. They see one of my videos. That took a little while to build, but Rome, as they say, was not built in a day. Make a landing page. I'm sure Erconia has something for you for information that you can put. I didn't create my own landing pages. I used their own. I added testimonials of patients who had the laser and had positive outcomes. I've added videos of patients. This is all a system to add to let people know that you have the device, what the device does, what conditions the device will help you with, and where you can go once you've added the laser. Now, let's talk a little bit about social media. I'm a big proponent of social media. There's so many different platforms. The platforms are growing, growing, growing. Let's start with the obvious ones: Facebook, Instagram, LinkedIn. You can just do posts. You can use Erconia's posts. You can make your own posts. You can take a picture of a patient. You can take a picture of yourself. You can take a picture of the laser. You can do a video like I do on social media. People will follow you. Get your own laser group. This is the world we now live in. Blogs, whether the blog's 1,500 words or a paragraph, blog on laser. Reuse what's out there. Start when we can get back to it. I know it seems like a distant future and a distant past. In-office demos. Get a few people. Get 20 people. When it can be done safely, get those in-office demos. Those in-office demos where you talk about the laser, where you demonstrate the laser on different people, will usually promote people to want to start to use it. And reach out to your line practitioners. So many medical doctors have come in because I reached out to them, and they were questionable about how they felt about chiropractic adjustment. I don't get it, but they were questionable about it. Some question the usage of supplements and things like that. But when they see the science, the aligned practitioners, and the FDA clearances, i.e. the medical, they will definitely refer you. And other aligned practitioners, those who don't have access to the laser or not utilizing it, we all want the best for the patient. So many people say, hey, go to Rob, I'm a chiro. Hey, I'm a PT, I don't own a laser. Go to him, try that, have that kind of outcome. So the aligned practitioners, a great choice. So a couple of parting shots before I turn on the video and go in the room for the FX635. Most of our patients come in because it hurts. So let's take a look at a couple of options. Let's change their lifestyle. Let's give them rehab exercises. Let's show them how to exercise appropriately. Let's change their life by getting them to exercise. And then let's do personalized nutrition or nutraceuticals. Add polyphenols, great for the gut, great antioxidants. Add curcumin, which has a pleiotropic effect on a multitude of pathways. Strengthen your microbiome. 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. Omega-3 fatty acids. Should be omega-3 fatty acids and vitamin D. that kind of combination is a great choice for overall health, great for immune strengthening. Allergic to fight obesity. Fight obesity with a good diet, changing their exercise. You can even consider Zerona and pain therapy. I put opiates in there. No way. Excuse me. If you wanted to deal with pain with your lifestyle, your personalized nutrition or nutraceuticals, add low-level laser therapy. Please keep an eye out. My book's coming out. Simon's going to support it. There's multiple sections on laser in my book, The Superhighway to Health, 7 Steps to Optimizing the Gut-Brain Connection. We are not done. So Oliver Wendell Holmes once said, the mind once stretched by a new idea never returns to its original dimensions. Here's methods in which to get in touch with me. There's my website, there's all my social, and at the bottom, I encourage you, we have about 350 people on my Facebook Mastermind Laser Group, which I am now going to extend a welcome and an invite to Simon to come on and to talk to my people in my group on how to market their laser in their different areas, their different economic areas, in the different areas in the world. So I'm going to turn on my, hey everybody, I'm going to go in my room. Simon, do we have any questions? I just lost that.
Yes, we have one that's just come in. Let me have a quick look.
Okay.
Here we are. What effect has the laser on telomeres, and how will that affect immunological conditions?
I think that's a great question. My data point on telomeres in my own office, there's nothing published as of yet. I'm just turning my camera on. So once again, my data point is my office. I do test telomeres and telomerase in my office. It's one of the blood tests I do. I've seen good outcomes with the telomere and the telomerase getting a little longer. Now understand that many people who I'm going for telomeres, not only do I use laser, I also use nutrition. So there is no published data on that yet. Something that I think that maybe you and I, Simon, should talk about, because that's a great question.
Okay, thanks, Rob. That's it for now.
No other queries? So we got a couple of minutes. Do you mind if I do a demo on the FX635?
Yeah, no problem. Go for it.
Who wants to? Talk about this one. Let me see you. Do you want to fix it? So Stephanie was kind enough to go face down. She's in a typical position that you'll see in many different offices. She's in a prone position. So I'm going to bring the FX around here. You want me to do it on the other side? You want to twist it around? So I'm going to put it, I want to go through the, so I'll go from here. No one can see my face, but that's okay. I'm going to do this. So you've got 3 diodes, 1, 2, and 3. Diode, I only have one of them on it right now. I'm going to put the other ones on. So how this one differs from the handheld, I look like the headless horseman. It's pretty funny. Hey, the handhelds are 7.5 milliwatts in the red, and on the EVRL it's 7.5 and 5 milliwatts for the violet light. These are 17.5. Now where they're different, can you hand me one of the lasers? I'm going to come over here and I'm going to stand right here, and you're going to see red and violet. So when you look at the red just goes straight up and down. The red doesn't circle. So you're getting a line of direction, which is wonderful. Put that in the pocket. Notice what you're getting here with the FX635. I'm going to leave it on. Okay, I got it now. it's circling, it's moving. So it's hitting the center point and it's moving almost like you would see a pie. This is a critical element because it's covering more surface area, but it's also going on and off, on and off, on and off. And if anybody's ever seen me truly lecture, I'm always moving the handheld. I don't have to because it's in a structure. This on and off pattern is critical because the body's getting the blast, it's not getting it, it's getting it, not getting it. It makes it want to absorb more. Again, the variability is a critical element. 17.5, little more power. They're all still milliwatts. You got 1, 2, and 3. 17.5, 17.5, 17.5. I'm going to turn it back on. And I'm just going to come right over here. She's in my flexion, distraction, traction table. And I'm going to cover her lower spine here. So take a good look from here. And can I? Now, I'll go on this side. If I wanted to, I could adjust her. I'm not going to adjust her right now, but I could adjust her if I wanted to while this is occurring. And I can tell you this, some people are, she's not, but there are people who are difficult to adjust. And in that difficulty in adjusting, when you add the laser, it's like a hot knife through butter, if you will. Also, I could have her, if need be, I could have her brace. On this particular table, there are certain movements she could do. She could, if I felt the need, I could put her in extension. If she wanted to, she could go in a tabletop position and she could do a bird dog. Also, I'm going to come over here. I don't know if everybody can see me, but there's a traction. Yeah, let's turn it that way. Excuse me, Steph. There's traction here. So I can try traction while she's getting lasered. So you're seeing a combination treatment. This is one of my more favorite things. And while I have her here, move this down, excuse me. If you have the FX635 and a handy dandy handheld, preferably an EVRL, I laser the back of the knee and the back of the knee while I'm lasering the lower back. This is an advanced move for sciatica. Now, if you don't mind turning over, I'm going to this up. And now I'm lasering her gut. So if somebody has some gut issues or you're into the gut to brain axis, there you go. You can now see a way to laser her gut. And if you really wanted to get advanced, if you will, while I have a moment with you all, you can do the vagus nerve while you're lasering the gut. And I'm just going to shut it for a second, leave her there. Simon, do we have any questions?
No, there's just a couple asking about the pricing of the lasers, so we'll answer that privately. Somebody's actually struggling to see the video demo. I'm not sure whether it's a connection issue or something isn't, ticked on the screen. But when we send the recording of the video out tomorrow, you'll be able to see it on there.
Yeah, I think they'll be able to see it because I was watching and it was clear, so it may be on their end. And like you said, they'll be able to see the connection. And if that individual still has an issue, Simon, I'm happy to FaceTime with you and them.
Sure, thanks, Rob.
So for me, I'm going to go back in the room. If there's no other questions, maybe we can have a little conversation. It's 3:13 here, so we got a couple of minutes. You'll be able to attach everything that I had asked about for them?
Yes, definitely. You're talking about the clinical side of the lasers and also the commercial side. They obviously work hand in hand together. So, the UK office is responsible for Europe, Middle East, and Africa. And we have a plethora of files that we can provide to anybody who purchases the laser, both clinically and commercially, either by way of our YouTube channel, where we've got lots of training videos, as well as PR videos. And, you know, when it comes to social media, as you say, it's just a case of trying to constantly provide fresh material. So we'll do what we can to help provide this, and we can edit documents so that it can, you know, that you can mention the clinic name within certain advertisements that we have.
No, I agree. And the reason it's called implement, it's not just implement the laser. It's, we have to talk about these things. It's tough at this point because, you know, with the health pandemic and, you know, we've spoken about it, we're not really sure. People need to know where to go. And you saw it was contactless. I never had to get in anybody's grill, if you will, with the laser. And a lot of patients truly appreciate that. The effectiveness is what I found most people resonate with. So again, if anybody has any questions, I'm always available via FaceTime. I've got all the different lasers. You know, I try and keep it streamlined when we're on a webinar. But if they have a question or a little bit more advanced, or even a question on how I promote it, you know, they just told me 2 people called on a laser in the 75 minutes that I spent with you. So that's what you're looking for.
Yeah, definitely. I think you've demonstrated the flexibility that the lasers possess. And that's something that we're doing a lot of when we're talking about prehab and rehab. But also Dr. Jake Cook, who's a neuro chiropractor from the UK, will be doing a couple of webinars soon, because he treats a lot of chronic conditions. And there's so many conditions he said he has that he hasn't been able to fix with standard therapies. And that's where also the laser can come in to try to help with, you know, these hard to treat conditions.
It's great. And I will say that, and I gave you guys credit, and you guys put me on to the rehab. There's no doubt about it.
Well, it's the way we look at it, and Dr. Rob Sullivan's done a lot of research on, you know, on cellular anti-aging. And the most simplistic way that we always explain it, you know, we all have certain levels of energy. So by actually having, you know, a treatment with the laser, we're delivering energy into the body. So the mitochondria of the cell is actually in a better position to supply the body with energy, and we're increasing viable mitochondria. So the patient's ability to fight disease, fight infection, fight viruses is in a far better position. We're doing a lot with different sports organizations, you know, especially in pro soccer, for example. You know, in the Premier League in the UK and in England, it's big money. And if one of the top players is out injured for 4 or 5 months, if we can provide a, you know, a laser to try to get them back in half that time, it means a lot of money to the club. So, you know, we're trying to get that balance between the clinical side, the education, which is extremely important, but also making it work for the clinic or the practitioner.
It's good to hear. You do a great job, and I think everybody knows that. And I'm just excited to be a part of the team, and I'm always ready to share.
No, appreciate that. And, you know, our mother company, the mothership across in Florida, Konya Corporation, you know, they received their first US FDA clearance on neck and shoulder pain in 2002. So that's been 18, 19 years worth of experience in the market. And, you know, 12 years that you've been using it, the lasers, Dr. Rob, you know, we want to try to share these experiences. We can do more, as you know, in Europe. We're not as closely governed by the US FDA. However, we do have to be very conscious of our parent company and different FDA clearances they're trying to get. But when it comes to implementing the lasers, there's certain things that we do slightly different across here. So again, it's good, I think, for our clinics and practitioners to be able to see things from both sides of the pond.
Agreed. And I'm excited about the opportunity at some point in the future, I'd like to say foreseeable future, to come over the pond, you know, have some fish and chips and lecture and share some nuggets with everybody. We're looking forward to that.
Definitely. Yes, we were lucky enough to have the company of Dr. Silverman, I think the Scottish chiropractic. It must have been coming up 2 years ago now in June. We had a seminar that we ran in London on the gut to brain axis, which was very successful. And we also I think you were asked to lecture at the McTimoney Chiropractic College, and they invited you back for a full 2-day lecture last year, but unfortunately, because of COVID and regulations, that had to be put on hold. But yeah, we can't wait to welcome you back. We very much value your time because I know how busy you are. So anybody has any questions for Dr. Silverman, post-call, get them across to us. He's always more than happy to share his time, which we very much appreciate, either by way of email or by way of FaceTime even. So feel free, don't be shy. And again, thank you very much, everybody. It is getting late. It's 8:20 UK time, so 9:20 Central Europe. Everybody go off and enjoy your dinner, and we look forward to catching up with you. We've got the part 2 of the underpinning of non-thermal lasers with Dr. Rob Sullivan next week, which again is covering a lot of the gray areas which not many people realize exist in low-level lasers, the different delivery mechanisms. Then part 3 will be the week after, and I think you're back, Dr. Rob, in the next couple of weeks, so we'll provide the subjects as soon as possible.
Absolutely, I look forward to it. Simon,
One
I got a
thing actually
request
there,
here.
Rob, for anybody who wants anything covered, by all means, email us. I think Julie in the office has sent all the invites out to everybody. If there's something, especially there's some of our existing customers on this line, if there's any topics that you would like covering and some education on, then obviously feel free. Brilliant. Thanks, Dr. Rob. Thanks very much, everybody. I look forward to speaking again soon. Thank you.